Welcome. I'm Leslie Canham.
I'm Mary Gavoni.
I'm Linda Harvey.
I'm Olivia Wan, and together we are the Compliance Divas.
Welcome to the Compliance Divas podcast on eye-opening tips on eye safety. My name is Leslie Canham, and I'm your moderator for today's podcast. We're going to cover eye hazards and injuries that occur to dental healthcare providers. We'll talk a little bit about the OSHA interpretation of protective eyewear and what's coming our way to change our usual view of what we consider to be safety glasses. And we'll also talk a little bit about eye safety. According to OSHA, thousands of people are blinded each year from work-related eye injuries that could have been prevented with the proper selection and use of eye and face protection. In a dental office, we encounter a number of hazards every single day, from flying debris to emissions from curing lights and lasers. And with that, I would like to turn the program over to Linda. Linda?
Thank you, Leslie. Well, thinking about eye safety, I realized that we all attended OSAP, and there was just an eye-opening, no pun intended, program that was presented by Dr. Peter Assenault. And he talked about the fact that 70% of all healthcare providers have some kind of eye trauma at some point in their career. And that is a significant number of injuries throughout healthcare. It's a huge issue. And whether it's flying debris or bloodborne exposure or now COVID exposure, we know ocular exposure is a very significant issue for us in healthcare. And on top of that, when you think about the high-speed handpiece, oh my gosh, that device is throwing debris back at the providers, the doctor and the assistant, at speeds up to 50 miles an hour. And that's a pretty significant rate of speed for something to be coming at your eye. With maybe little to no proper eye protection on. And, over the years, we've all known the fact that we should not just be wearing our prescription glasses, that they had to have side shields. But now, as our listeners will hear today, there are so many other considerations when thinking about protecting your eyes. And you only have one shot in life with the eyes. So it's got to protect ourselves and be proactive, because some of the debris coming at us includes things like the aerosols, the spray, the splatter, all the bloodborne or COVID, viruses, tooth materials, calculus, pumice from hygienists, broken dental burrs. We know that happens on occasion and they go flying, and just different pieces of amalgam and other restorative materials that occur during the numerous different dental procedures. And one thing that was interesting about Dr. Arsenault's program was the fact that he mentioned his own story of having some type of ocular injury in his practice, and he had to go be treated, and of course missed time at work. And his ophthalmologist was examining his eyeglasses and commented about the fact that they had just a lot of pitting on the outside of frames, outside of the glasses. And he asked him, what do you do for a living? What's all this on your glasses? Why do you have all these little pits and nicks in your glasses? And Dr. Arsenault realized that was the fact that his glasses had been protecting him from all this debris flying into his eyes. And it was calibrated and documented and bona fide, this was protecting him. So we realized this is a really serious issue for us in dentistry. And so with that, Mary, I think there was another story I wanted to ask you to kind of give us some background on about that dental student as well.
Thanks, Linda. Yes, Dr. Arsenault shared a story about a dental student who was wearing, according to his narration, all of the required PPE, safety glasses, a face mask, gloves, protective clothing when he was treating a patient who happened to be HIV positive. And he got some splatter of blood into his eye despite having these safety glasses on, and it actually came up from the bottom of his glasses where there was a gap underneath from where the glasses did not touch his face. And because that is a significant exposure, that splash onto a mucous membrane, and especially the eye being a very vascular area, he needed to go through the prophylactic medication to prevent himself from becoming HIV positive. And he shared how the side effects were very serious, and it impacted his work life and his family life and so forth. And that is, for the most part, a preventable event from happening. I think back, and I've shared this story with my fellow divas before about my first job as a dental assistant. And my doctor, this was back in the early 1970s, and my doctor insisted that I wear safety eyewear because of all the things that you just shared, Linda, about the projectiles coming from the mouth and infectious disease and so forth. And I really balked at it. But once I really was working full time at chairside and felt the same thing. All those projectiles coming at these glasses that I wore. I had just a pair of large lenses in an eyeglass frame that I wore over my contact lenses, and stuff was bouncing off my glasses all the time. And I was fortunate that I didn't get anything that I was aware of in my eye, no projectiles, but who knows about any kind of infectious disease. So one of the things that Dr. Arsenault mentions throughout this story, talking about this exposure, is the importance of closing the bottom gap. Does your safety eyewear actually touch your face or protect your entire face? And OSHA has sort of shifted its guidance on protective eyewear, which Olivia is going to talk to us about, to help prevent not only injuries from debris flying at us, but from infectious disease transmissions through the eyes.
Yeah, thank you, Mary. I think it's important for our listeners to realize that employers are required to provide a safe place to work free from recognized hazards. And so vision safety is not optional. So we look to OSHA for regulatory information. Now, I've been in dentistry, like many of you, since 1985, and I've seen people not wearing safety glasses at all, not wearing shields, or only wearing prescription glasses or readers. And we understand that this is not satisfactory. So we know that vision safety is problematic as a safety issue. So once again, we look to OSHA. They published the eye and face protection standard in 2016, and that dictates that the employer must provide appropriate eye protection. And that leads us to the ANSI standard. Now, ANSI stands for American National Standards Institute, to determine what exactly is appropriate for eye protection. The old ANSI standard did not address bloodborne pathogens or biological hazards. So therefore, the new standard, which is ANSI Z87.62, includes more detailed description of the proper eye and face protection that workers are exposed to relevant to biological hazards. And then, Mary, as you mentioned, we also piece in CDC's guidance for dental settings, and CDC makes reference to goggles or face shields. And in regards to sequencing, we should have our protective eyewear in place before we go into the treatment room. And so regular safety glasses that do not give full protection, or there's gaps, which means there's inadequate protection, would not be considered appropriate. So it's just a healthy reminder for our listeners who are safety coordinators that if the clinical people are wearing personal eyeglasses or readers, they do not provide adequate protection. So we should address vision safety in our COVID plan, as well as in our plans for personal protective equipment. And then, Mary, I get the question, well, what do we do if we address this with someone and it's not effective and they continue to wear cute little colored readers or their eyeglasses? What do we do? And I think that we have to have good HR policies in place, and the safety coordinator should understand what is their level of authority. Do they address it with simply retraining, or who would fill out a disciplinary sheet stating that this was incorrect? Because keep in mind, if there's an eye injury like what Linda talked about, that's going to trigger a workers' comp claim. And so that's our job. We're being charged with safety. Mary, did you have a comment?
I did, and I'm glad that you asked that question about what do you do if someone refuses to wear their personal protective equipment. OSHA actually requires employers to have some type of a disciplinary protocol documented so that if someone doesn't wear their personal protective equipment, there are consequences to them. So if I were working in a manufacturing setting and I showed up for work without my steel-toed boots and they were required, I probably would be sent home. It's probably not so realistic in a dental setting, but there needs to be documentation of, as you said, Olivia, we address it with retraining. If somebody continues to disregard, then that could actually be a reason for dismissing someone from the practice because they're not following safety guidelines. OSHA not only says that employers must provide the training and the PPE and all that, they also state under the General Workplace Safety Standard that employees must follow safety protocols. So there's a lot of liability issues there for an employer who doesn't enforce.
And to supplement what you're saying, Mary, many years ago when I was in law school, I studied a case where a utility worker was electrocuted and died and did not have on the appropriate PPE. At any rate, and he didn't die, excuse me, he was hospitalized. So there was litigation back and forth. He was able to get a workers' comp claim. Workers' comp appealed and won, stating that the employer had documentation of training, the employer provided the PPE, and the insurance felt that they shouldn't have to pay all these medical expenses because of his non-compliance. So what if that happened to one of our dental workers? What if workers' comp denied the claim because they knew there was training and appropriate PPE? Linda, what can you share with us?
Olivia, that's exactly where I was headed. I don't have such a vivid story as you do, but when I managed workers' comp for a couple of clinics when I worked in healthcare risk management, every time I had to report a claim to our carrier, I was asked whether the worker wore their PPE. And it left me with the impression that would their benefits be denied or lessened if they didn't wear the PPE? And secondarily, as you were saying that, I was recognizing the fact that loss of eye triggers a report to OSHA for the reporting section of that. So you have an employee who loses an eye due to a work-related incident, that's reportable to OSHA.
So it really does pay to protect your eyes, and ocular injuries can occur. There's infectious agents that can get in our eyes. I don't know if you've ever had pink eye, but that's probably one of the most uncomfortable conditions, and it's highly contagious. So I remember in the past, before protective eyewear was something that we were accustomed to, and I've been in dentistry since 1972. So I remember not wearing protective eyewear and hearing cases of dental workers getting ocular herpes because they got splashes and spatters of blood or saliva in their eyes providing treatment. One of the things that comes to mind also is the different kinds of exposures that we get when we're working with a patient. When you think about the flying debris, so that's like shrapnel. And I have two dental clients that had severe eye injuries. One was actually wearing his loops. He was wearing loops. He was separating a porcelain bridge, and a piece of the porcelain flew out and hit him in the eye, even though he was wearing his loops, which you would think provide a degree of coverage, not as good as safety glasses or pardon me, goggles or a face shield. But it still was quite an injury that caused him to have to stop treatment and go right to the emergency room to have that fragment removed from his eye. Another dentist had to give up her career in dentistry as a result of an injury due to a flying particle that embedded in her eye, and her vision was not the same after that. She had depth perception problems, which really was a good reason not to practice dentistry any longer. So it was a shame because she was a young dentist and had a fairly productive practice. I also want to share the story of a young lady who is a patient in a dental office. I heard her speak at the OSAP annual session a few years ago in Atlanta, Georgia, and her story really impacted me. It not only the tragedy that she went through, but the way that she described the events. Her name is Jen Marone. And most of us in dentistry know who she is because she's made quite a bit of noise in the industry to bring attention to the fact that she was a dental patient. She went to her dentist for a simple root canal one day. And as they passed the syringe, dentist to dental assistant, she described it as somebody fumbled, they dropped the syringe, the needle landed, poked her in the eye. She also further described the events that followed that. She was not provided emergency first aid, no trip to the eye wash station, no trip to the emergency room. They just asked her if she was okay, handed her a tissue, continued on with the dental treatment. Well, later that day, after the numbness wore off, she was in quite a bit of pain, and she went to the hospital and described excruciating treatment that was provided to flush her eye. And no matter what they did, an infection still ensued, and it became an infection that was not responding to the antibiotics that she was given. She ended up, long story short, she lost the vision in her eye. And it was also rooted in the fact that nobody offered this patient a pair of safety glasses. So her mission has been, ever since this occurred, to bring awareness to dental professionals, not only protecting their own eyes, but as a patient, to bring patient awareness up that if your dentist doesn't offer you protective eyewear, ask for it. And if they don't have it, maybe take out your own sunglasses or your reading glasses, something to protect your eyes. And on the other side of the stick, when we offer our patients protective eyewear and they backpedal, they say, oh, no, thank you. We should be reminding them that we work with caustic agents in dentistry. Sometimes we have etchants or other materials that could cause irreversible eye damage. And that explorer or the scaler that we hold, their eyelid, even if they close their eyes, isn't going to protect them from a scaler that gets dropped out of the hand by mistake. So protective eyewear for patients should be also part of your eye safety plan. Olivia?
I wanted to supplement what you're saying, Leslie. I had a dental assistant, one of my clients asked me some years ago what to do with non-compliance from patients not wanting to wear the safety glasses. And so we looked at the verbiage that she was using. She would hand the glasses to the patient and say, do you want to put these on? And the patients would say no. And so it shouldn't be optional. We should hand them the safety glasses to put on. And if they complain, we just say that's practice policy for safety. As you mentioned, Leslie, there's so many things that can happen during a dental procedure.
One way that I describe that, to piggyback on that, is the fact that this is a 100% preventable medical error. 100%. And I think we could look at the same way for ourselves as healthcare providers, even though typically when you think of medical errors, it's injury or near miss to a patient. I think we should think of the same way for ourselves. It's 100% preventable.
And I think that many of us get the question from our clients all the time, does OSHA require us to provide safety eyewear to patients? And they do not. And not because they don't care about the patients, is that they don't have any jurisdiction over patient safety. But the CDC guidelines for infection control in dentistry and the summary of infection prevention practices both recommend that we do provide protective eyewear to patients. And I totally agree. We don't make it a choice. We tell them this is our policy. Just like we wear eye protection for safety, we want you to wear it as well to be safe.
Another patient to not forget are the children. And a lot of times our safety glasses that we see are the trauma glasses that we're moving away from in dentistry. You can buy, especially this time of year during the summer, you can buy little kiddie sunglasses and they're adorable. The kids love them. They're a lot of times inexpensive enough where you can actually probably send a pair home with the child. So that saves you from the disinfection process from child to child. But we want to make sure that everybody's protected. I also had a kind of a fun little activity that I would encourage my dental teams to do. When we talk about safety eyewear, and I really encourage a face shield, I wear prescription glasses, and it's always kind of lumpy to put another pair of safety trauma glasses or goggles over my prescription glasses. So I'm a big fan of a face shield. And I noticed when I wore a face shield that my skin and my face was a lot cleaner at the end of the day. I didn't feel, yucky and sticky. And so I challenge my dental teams. I'd say in the morning, when you get to your practice, take a 2x2 with some alcohol and just clean your chin and neck area. Just clean it so it's nice and clean. And then at the end of the day, take a 2x2 and some alcohol and just clean your neck area. And then take a look at what you see on that 2x2. And you'll notice that you really get pummeled with quite a bit. There's all sorts of, they see flecks of blood and spatter, and they see little tooth particles. And that's what we want to prevent ourselves from, not only having pummel us in the face, but also we don't want to be inhaling that. So of course our mask is going to protect us from that. Anyone else have something to share about your past, Mary?
Thinking about all the changes we've made during COVID and adding extra PPE, it makes me think of wearing head coverings. And I can remember in my dental hygiene days doing gross debridements on patients and going home and actually finding little spicules of calculus in my hair, which made me go running for the shower. And it just stands to reason that when we're working on some of those patients, as much as we don't like to put all that PPE on, we are exposed. And I think the one good thing that COVID has done for us is make us take another look, a closer look at the risks that we're really being exposed to. And I still hear people squawking about wearing respirators and they don't like the additional respiratory protection, but and they want to go back to the old way. But in some cases, the old way was just wearing, and someone mentioned wearing readers, which provide almost no eye protection whatsoever, or prescription glasses, and wearing a face mask, kind of like a chin cup underneath your chin or underneath your nose, putting ourselves at great risk. And now we know that the risks are greater and we need to be better about mitigating those risks.
Mary, just to piggyback off that, think about how many offices that we've all been in where we've witnessed and discussed with team members that they didn't want to wear the level 3 mask because they couldn't breathe. So after our training, when they would agree to, kind of move back to the direction where they were supposed to be compliant and supposed to be safer, a few weeks or a few months later, we find out from their sales rep or anybody else in the practice, well, we're kind of went back to our old habits again, or we don't want to wear the level 3 anymore. We just tried it for a week or two and it didn't work. And so we're in that same stage of adaptation now. And I think all of us that are practicing today need to give ourselves permission to be open to that change and looking at the different safety aspects that we didn't follow before and weren't aware of. And on top of that, just one of the big takeaways for me from the whole issue that we're talking about today is just that bottom gap entry route. We don't really think about that because we can't see down there. We're looking at what you can see from the side shields or at the top. And I think that's a big takeaway today. Leslie.
It brings to mind an event that occurred for one of my clients where OSHA actually came in and challenged him. Now, in his case, his dental assistant came into the office in the morning to prepare for the treatment for the day. One of the procedures was a root canal, and she was preparing the bleach, the sodium hypochlorite and irrigating syringe, and she didn't have any PPE on. She was simply getting the treatment tray ready and prepped. Well, instead of drawing the sodium hypochlorite from the cup into the syringe, for some reason, she poured it into the back of the syringe this day and put the plunger on the syringe. And when that happened, some of the bleach splashed out, hit her in the eye, and, bleach is corrosive. So she ended up in the emergency room. It turned out that OSHA investigated, and I'm not sure how OSHA was alerted. I don't know if the emergency room let them know or how, or whether maybe the employee did, but the employer had to go through miles and miles of red tape to justify the use of a corrosive agent in dentistry. Now, number one, she should have been wearing her protective eyewear. And I want to remind everybody listening that it's not just when we're providing patient care, it is at all times when we're exposed to chemicals or other hazards that could cause damage to our eyes, even when you think you're just setting up in the beginning of the day. And the other thing that happened, it was funny, he shared with me, he had to show the OSHA safety officer an old textbook that described that sodium hypochlorite or bleach is actually something that is used in dentistry. He had to justify why she was even using it. Olivia?
I wanted to mention that we had an office in Tennessee that was randomly inspected by OSHA, and the investigators cited the dental practice. The assistant was not wearing appropriate safety glasses, and the assistant was trying to argue, well, I'm using wipes. But when the OSHA official looked on the product label of the wipes, it said that you had to wear safety goggles as part of the PPE. I mean, OSHA just read it right off the label. So even though the assistant didn't feel like it was necessary, OSHA pointed out that that was not compliance with the manufacturer, and they were cited.
And they'll find that information on section 8 of a safety data sheet, right? Each and every time, and on the product label itself.
And the one thing we haven't talked about yet in terms of eye safety is, of course, the eye wash station. And so everybody needs to make sure that they have at least one installed in their facility, possibly more depending on the size, that it's working correctly. It should be monitored, and there should be a log that it's checked monthly to make sure it's operational. And everyone needs to be trained how to use it appropriately, depending on the type or the style of eye wash station that you have. And there needs to be a sign identifying that that is where the eye wash station is, because once something gets splashed into someone's eyes, it's kind of like an exposure incident, a needle stick or something. Panic sets in and logic goes away a little bit. And so we all need to be prepared to make sure that we know how to use that eye wash station appropriately to prevent further injury to an eye.
That is absolutely incredible advice, Mary, because we don't think about the exposure incident to the eye, whether it's blood, body fluid, chemicals, particles, all of it ties together. And something else that we didn't mention was storage of chemicals. I always recommend that liquid chemicals and powder chemicals be stored at eye level or below. So there's never a chance that somebody reaches for a bottle and maybe the cap isn't screwed on properly and it ends up spilling over into their eye. And I get these ideas from actual accidents that happen in dental offices as the dental team describes experiences that they've had. So I think we would agree that this has been an incredibly eye-opening podcast on eye safety with lots of great tips. We like to bring clarity and simplicity to compliance by navigating not only the regulatory environment to keep you on course, but also to share some of the experiences that we've had. So you'll learn from some of the errors of others that have gone before you. You can subscribe to the Compliance Divas podcast through your favorite podcast channel or on our websites, thecompliancedivas.com. We have resources that are connected to the information that we provided during this program today. They will be available during or on our Compliance Divas website. And we're also always welcome to questions. Submit your questions to support@thecompliancedivas.com. And with that, this is a wrap for eye safety.